maintain. Not the United States, not China, not anybody else.
Frenemies. This and more. Streaming on the world's first news OTT, News9 Plus. Download now. World Health Day, World Heart Day special, something that is synonymous when it comes to heart and health. And we today are examining the factors and the measures that help us keep our heart healthy. Why it is important? Because obviously in this time and age when stress, when tension has become almost synonymous to our daily lifestyle, daily routine, then it is imperative to keep our heart in a good health. Now, advancements in technology, diagnostics and pathology have revolutionized cardiac care, significantly contributing to heart health maintenance. These innovations enable early detection of cardiovascular issues, allowing for timely intervention. Advanced diagnostic tools and pathology techniques help in precise disease assessment and tailored treatment plans. Telemedicine and remote monitoring ensure continuous patient care, especially in remote areas. Wearable devices and mobile applications promote health awareness and heart-related issues, and the monitoring of it is also important. Artificial intelligence too has entered the field, and it aids in data analysis and predictions. Genomics contribute to personalized treatment, strategies and innovative breakthroughs continue to improve outcomes. To sum up, the elements collectively empower individuals and healthcare providers in keeping the heart in optimal condition. Well, this is something that is easy to read, but to understand it better and to rest assured that our heart is also in good hands, I have the very pleasure and honor to have three distinguished guests with us today. Dr. Ajay Kaul, Chairman, Cardiac Sciences, Fortis Noida, is here with us. Dr. Prashant Nag, VP Diagnostics, Tata 1mg, and Dr. Varun Bansal, Consultant Cardiology and Cardio Thoracic Surgery, Indraprastha Apollo Hospital. Gentlemen, thank you so much for taking time out of speaking to us, and trust me, it helps a lot when we hear it from you, and knowing that yes, there are techniques, technologies and various ways to assist us in the time of need is really very reassuring. Dr. Kaul, beginning with you, when it comes to the diagnostic part of it, when it comes to the technology part of keeping the health of the heart in shape, how best do you rate or you suggest that the facilities that we have in India is helping us to actually tide over this crisis?
See, let me tell you one thing, facilities in India are one of the best in the world at the moment.
Right.
This was not true a couple of years back, but in the recent times, and this you will realize because we have a flood of international patients coming to us from all over the world, not only from developing countries but also from developed countries like Middle East and say Europe and other places. They come to India for treatment because it is quality is world class at a low price. So that is one thing.
Right.
And second thing, since we are discussing about this technology, let me tell you one thing. In my practice, I am very happy if I see somebody jogging or running with a tracking device or wearables.
Right.
I think this has revolutionized everything. Patients come to me, otherwise they, main thing in management of health, say for example, if you want to make sure that the incidence of heart attack goes down, hypertension goes down, diabetes goes down, these variables are going to change everything. People come to me, sir, today my blood pressure was 140 when I realized that it was high. Or somebody comes, yeah, saturation was low. This has revolutionized the whole medical treatment. One good thing is wearables.
Definitely. I mean, see, there is, as our learned viewers would also agree, कि मॉर्निंग वॉक पर जाते समय ये ध्यान रहे कि नहीं कि जूते कौन से पहने, ये ध्यान जरूर रहता है कि भाई मेरी वो घड़ी या मेरा वो ऐप तो तैयार है कि नहीं. Dr. Nag, talking about health issues or keeping the health of the heart in good condition, CVD health also comes up as one of the critical areas. Could you please help us understand about the CVD health part?
So basically CVD is cardiovascular disease, and when we are talking of CVD health, in layman terms what we are talking is how healthy our heart and vascular system is.
Okay.
So see, heart is the organ which pumps the blood and through which all the nutrients go to the body.
Right.
So I'll keep it very simple for the viewers. If your heart is pumping well, your whole body is getting nutrition, you're definitely going to have a healthy long life.
Right.
So whether it's longevity or the quality of life, the heart health is the most important parameter when we talk of overall health in an aging person. As we all know, as per the data, in non-communicable disease, it is the cardiovascular diseases which forms the major mortality and morbidity cause.
Right.
Just around 50% of NCDs by cardiovascular diseases. So working on a positive cardiac health is something which is really a very good thing. And in CVD health, most important thing is preventive and timely intervention. Early treatment, preventive treatment are the main key stakes which help us in promoting a good cardiac health.
Right.
So whether it is longevity, whether it is quality of life, the economic impact, all these things are very, very important when we talk of heart health. So, so just to summarize, when we talk of CVD health, it is the positive part of the heart health which we are talking about.
Right. Indeed, and obviously cardiovascular disease is something which is a very innate part of our bodily system also, I would say, and why not the powerhouse and the control center, as they would say. The heart needs to be in good condition. And very true, gentlemen, when we talk about current days, abhi ke samay ki agar hum baat kare, so there are so many obviously gadgets, both medical and non-medical also, wearables, as Dr. Ajay also mentioned. Dr. Bansal, for the youth of the country today to know that yes, these are the assets that we have, these are the gadgets that we have, yet there is something that is called discipline, and it is very important when it comes to keeping the health of the heart in a good shape. Help us understand how important it is as of now for all of us to not just wear that wearable, but also do the needful other than that.
So thank you so much. It's an extremely clever question, I would say, because
applies on me, so I think applies on everyone.
So I would personally believe technology to be enabler. It will not do everything on its own. So we have to do something for technology to enable us. All these wearables will tell us what is inside. Maybe they will tell us about heart rates, about our blood pressure. Those will not change it.
Yes.
Diagnostics tools will tell us what is problem within, which is not apparently shown as of now, which has not come to a clinical scenario present with symptoms or signs. Treatment methods will tell us how we can do something which is complicated in a very simple way.
Right.
Overall, technology is an enabler, just like your smartphone.
True.
A couple of decades back, when we were using smartphones, you could take a call, make a call, read a message, send a message, and that's it. Now, through phone, the same phone, you can do phone banking, you can do social media, you can reach out to more people, you can do many things. Similarly, all these gadgets can just empower us to track things more and work over them. But finally, we'll have to work over them.
Definitely. Absolutely.
So we cannot think that wearing a watch will help us if we do not help ourselves. We have to go for a walk, we have to go for a run or maybe a swim, and then we have to make ourselves healthier. We can see our risk factors, what we are there in our families, we can get diagnosed early, maybe predict outcomes or predict health problems which we might have a couple of years from now. But to prevent those or maybe to postpone them, we'll have to act ourselves. The technology will not act for us.
Definitely. And
technology is not within us, it is helping us.
Enabler, as you mentioned.
Yes.
That's the bottom line. That's the bottom line. I couldn't agree more with you, Dr. Bansal, here that obviously bin khud jale na ho to jala, as they say. Let's, yes, technology can take us to a certain point, but
Yes.
then we'll have to cross the bridge when we reach there.
Absolutely.
Dr. Ajay, talking about, as you mentioned, that in India we have seen a sea change as far as the technology is concerned in cardiovascular sector. Help us understand some of the cutting edge, say, diagnostic tools that we have today and which are transforming the cardiac care in the country.
See, let me start with there are I would classify into two things, two divisions. One is pathological diagnostic.
Okay.
Earlier, say for example, 50 years back, we used to say blood sugar. You had to mix reagent, urine sugar basically. You had to mix some reagents and then get a color, and that was the sugar is positive.
Okay, right.
Then we came with analyzers which were huge of this size, and so give a blood sample and then you get the reports.
Right.
Today we have blood sugar machine that is this big. Imagine. And dry test. Whatever you need. It may be blood gas, it may be cholesterol, it may be serum creatinine, it may be a patient coming. Something, when a patient comes with heart attack to our OPD, the first thing we do is TROP-I or TROP-T or some other test, which is just a dry test. We just put a sample of blood and you get instant test.
The machine tells you that.
Absolutely. So this is a revolution. In fact, I don't think I've used my stethoscope for the last 5 years. I just look at these tests and that's the diagnosis. Then second comes is the huge machines like, CT scan, MRI, PET scans. All this has changed, and this with artificial intelligence. Let me tell you one thing.
Key factor.
A doctor can analyze only few reports in a day. If you have all these machines AI enabled,
Right.
it's going to change. I mean, we are just seeing a small stream flowing. It's going to be an avalanche in next 5 to 10 years. It's going to change everything. With AI, there was, industrialization, computers, and now it is AI. Everything AI.
Right.
So all these machines, today a CT scan machine can not only diagnose a coronary block, it can also tell you whether you need an angiography, what is the degree of block, whether you want to go, whether you need a stenting or you need, that's called FFR or IFR. So it tells you how much of obstruction is there, how much of flow is there. All the PET scans. A cardiac PET can tell you how much of muscle is damaged, advanced MRI. So there has been a tremendous change, and really these all new gadgets have given us tremendous ability to diagnose these things.
Dr. Kaul, you have actually summed it up in a very reassuring manner, because knowing that AI, although for certain reasons and for certain sectors, AI, as the debate is raging on across the world, that is, a somewhat risky affair also, maybe counterproductive in some terms. But when it comes to medical sector, for a country as big as population as India, I think you are absolutely right when you say that there could be an avalanche of, treatment numbers. You would be able to actually treat more and more people, as far as with the assistance of AI is concerned. Dr. Nag, AI is one aspect of it definitely, but then as far as the pathology is concerned, as far as the blood testing is concerned, how it is related to testing the health of the heart, first of all, and secondly, what role does it play? What critical role does it play?
Blood is, what we do is, in cardiovascular disease, what is most important is risk assessment.
Okay.
And for risk assessment, we use blood biomarkers. So these biomarkers can be simple proteins like Dr. Ajay was talking about troponin and all. So, and then can be predictive markers, simple lipid profile, blood sugar. Then there are diseases which complicate cardiovascular disease like diabetes and all. So tests for diabetes, HbA1c, glycemic index, it tells the glycemic index. Then kidney function test. Then there are special genomic markers. Right now, science has progressed very much in genomic side. So right now we can do the predilection markers from the genetics of that person. So which can predict or tell that there is a predisposition for cardiovascular diseases. And that can help a lot in terms of defining the lifestyle, behavioral changes to that person. So overall, in diagnostics, blood pathology, there's a lot of changes which technology has brought.
Right.
Aiming from proteomics, getting natriuretic peptides, troponins, and then genomics, getting personalized medicine. So there are a hell lot of changes, and these are really helping because all is in early diagnosis and assessment.
Right,
So
right. Very important, very key factor, you know, when it comes to the traditional part of the treatment. Yes, indeed, there is AI, there is assistance from other scientific technologies, but you are absolutely right, Dr. Nag, and that's why it is very important also to consult and to get in touch with the agencies which actually are trusted names as far as the pathology of the disease is concerned. Dr. Bansal, you know, one thing that I must compliment you on is the young age that you have entered into this profession.
Thank you.
Very serious profession, I would say, and both Dr. Kaul and Dr. Nag bring a lot of experience to the table. One key aspect that many of our viewers who, by dint of internet penetration across the country, from the rural India part would also want to know from you that as far as these technologies are concerned, you know, we are talking about game-changing technologies, but for the rural India, how best these services could be reached and availed? Is it that the patient has to mandatorily come to a Delhi or a Mumbai or a Noida, or the penetration is deep inside the country also when these cutting-edge technologies are concerned?
So the penetration of technology is growing every day, and for certain diagnostic tests, patients do not really need to come to the metropolitan cities.
Okay.
There are remote tracking devices as well. There are remote ICUs being monitored, and if just to give you an example, if there's a ECG which needs to be monitored over 7 days, it's called ELR, loop recorder. It can be done remotely. The patient can get a device tied around his waist for a week. He can go back to his work, go back to his place of where he lives, and maybe after a week he can just make one visit to a city, get diagnosed. He doesn't need to stay in the hospital, stay in the city, and telemedicine is working. They don't need to come for every consultation that they need. They can always consult people over the phone, over a WhatsApp call, there are various networks which many hospitals run for telemedicine, where people can reach out to us from remote cities, even from remote countries. So it is not only restricted to the metropolitan cities, and people do not always need to travel. The penetration is growing every day, and I am sure it is not far that everybody, each and every person in the world will have access to best of the healthcare facilities, whether it is India or abroad. Anybody can reach out to any doctor. The technology is so big and so huge.
Absolutely, absolutely. That's once again reassuring, I would say, and for those of our viewers who would be watching this broadcast, you know, sitting in remote part of the country, the assurance that you know, comes from the science and technology sector, from you know, enablers like Tata 1mg and other assisting services. Definitely the reach, the penetration, we saw how you know, the COVID-19 situation taught us a lot of things, how India vaccinated its people in far-flung areas also manually, and reaching them in during testing times. Dr. Ajay, speaking about the reach and the population part of it, you know, the one key issue that comes to our mind when it is heart related, कि मुझे heart attack ना आ जाए, या मुझे heart attack इतनी जल्दी कैसे आ गया. A lot of things. I mean, I was speaking to one of my colleagues who is in Doha as of now, and he sounded low, and when I asked him, sir, क्या हो गया, सब ठीक है? He said, Pankaj, I suffered a heart attack. Now this I could not imagine also, and trust me, he is not too senior to me, and then I felt that, am I also susceptible? Aapka message, Dr. Ajay, what is your message to keep the heart in good health, and also not to be surprised if the heart attack is happening before the age of 40?
See, I would summarize it in few sentences. What we have to understand is, we Indians, Asians, we have a extremely high incidence of heart-related problems, cardiovascular diseases. So let's not take it lightly.
Okay.
Each one of us is prone for these problems. So first thing first is, if you have a, see, there are certain things that you cannot change, and one of them is your parents. If genetically you are prone for this thing, your father, mother has coronary artery disease, you will have it. If you follow a good lifestyle, you will delay these problems. If you don't, it will come at the age of 40, 30, whatever. So this is one problem. The second problem is, you can't prevent aging. So the moment you are, you are getting older, you have to understand that you are not as fit as you were at the age of 20. So the moment you are around 30, 40, please consult a doctor. Make sure that you get a general checkup done. The third thing is male, female, sex. Male are more prone for cardiac problems before the age of 45. I mean around 45, but females have got sort of natural protection. But after 45 they catch up and almost the incidence is same. Then there are certain diseases like hypertension, high blood pressure that we call normally, diabetes and cholesterol. Now these are silent killers. Hypertension has no symptoms, diabetes has no symptoms, dyslipidemia has no symptoms. Even if you have these problems, and that is where these labs and other places come into play, please get your checkup done. Make sure that your cholesterol, if your cholesterol is normal, is high, let me tell you one thing, you have to go to a doctor and make sure that you get it, sorted out. I won't say that you straight away go on statins, but the doctor will tell you what to do. So this is the third thing that you can't, these are unavoidable things.
So quite relatable also for, for all of us, talking about, as I mentioned in the beginning of the show also, Dr. Saab, that stress, tension, lack of time for exercise, all those things have become the part of our life. But as Dr. Kaul mentions, it looks like that these early markers, we should not be avoiding them.
See, these 5-6 things are not, you can't get rid of it. I mean, this is with you. Then there are two other things that you have to be careful. One is, these are what I call is, you can't do anything about it. And other thing is your job. Suppose your boss is crazy.
Talk about it.
And he gives you a tough time. Or your family, your wife is nagging. So what do you do? So this stress is also, and you are living in Delhi, again full of pollution and other problems.
Very, very key aspect.
What do you do about it? Now this is another. These are non-preventable. Then there are certain preventable things like smoking, drinking too much of alcohol, anything white like sugar, salt is to be avoided. This is bad. Then eating a lot of trans fat, that is cookies, burgers and other things, and Coke. Now these are bad things. Then other things are like good sleep, that is 6 to 8 hours. And as far as possible, walking, I always say walking 3 kilometers in 35-40 minutes is the best exercise in this world. You don't need to go to gym, because if you are bodybuilding, that is unnatural.
Well, see, I mean, Dr. Kaul, I'm mesmerized, and I'm thankful that today we got the time and opportunity to sit together and discuss these things, because time and again, people would say, ki, haan, doctor ne mujhe ye kaha tha. But today I could realize, I could feel it, ki kitna important, how important it is to follow these small pointers, starting with me also. I will have to do that as well. Dr. Nag, Dr. Kaul has actually hit the nail on its head. I mean, he couldn't have been more direct than this. Talking about the detection of a heart ailment, blood testing and is an important aspect, definitely, but technology, diagnostic, pathology, all these put together, they are helping us to lead a better life?
Yeah, definitely. As told by Dr. Varun also earlier, that it is primarily an enabler. So it is enabling all aspects, starting from right now, starting from home collection to better technology in testing, to better imaging techniques. At all places, technology is playing a very big role. See, in home collections right now, we have such a sound logistic systems which can ensure sample stability by managing temperature and timing, real-time monitoring of the same. On the biomarkers part, we have already talked about the new biomarkers which are there, which can really predict things on time. We have genomic biomarkers. on advanced cardiac imaging right now. As sir has said, that right now our imaging techniques are so good that they can really tell at what level of disease you are and what prognostic, what is the prognosis of your disease. So overall technology has impacted all the ways, like remote monitoring, telehealth. These all are primarily plugged by technology. So when we talk of preventive health, technology is something which is really helping us to go deep and timely.
Right.
See, I'll be very, very upfront. Overall in India, we don't talk of health in a positive manner. We talk of health when we are sick. So that is, we always talk of negative health.
That's the sad part.
So these wearables, this preventive testing, these all are steps towards positive health. And that is the only way we can reduce the cardiac morbidity. The amount of effort required, money required after the disease is far more than the effort required in maintaining a positive health. So all that technology is helping in moving the whole awareness and every part to the positive health. So I think technology is a big enabler.
True, definitely, definitely. As you mentioned, penny wise, pound foolish. हम आज तो मान लीजिए अगर अपने health पर invest नहीं करते हैं, बाद में to fix that thing becomes a costly affair. Before I come to Dr. Bansal, Dr. Nag, I wanted to also ask you, since you mentioned the changes that have happened recently, COVID, how important or how big a role it has played as far as the safety of heart is concerned, COVID-19?
See, COVID-19 was a viral disease, and viral diseases overall have many impacts across your body.
Okay.
Since it was a highly transmissible disease, affected a large population, so we are able to study those effects far deeper. And what we are seeing, that there are long-term changes as well as short-term changes. People are coming with delayed with their cardiac damage in their heart muscles, etc. So it is affecting cardiovascular health, and long-term effects are being seen. Then there is some lung damage, residual damage to COVID, which is affecting the cardiovascular health. So yes, COVID has affected health very negatively, but I'll still say a good part of COVID is that it has brought the awareness for the health. Right now we are talking more of health after we have seen how small we are in front of if health goes negative. All resources put together of the world were small in front of that virus. So I think we should take a lesson out there, and we should be more proactive on the health part.
Definitely goes without any saying, Dr. Nag. Thank you so much. Dr. Bansal, when we look at the health practices in the country, gentlemen here were absolutely right when they say कि Indians per se उतने serious नहीं है, talking about the regular health management too, for that matter, small health insurance also. When you are dealing with patients, and a lot of the viewers who are watching it, what is it that you find unique, maybe common in the cases, generally in the younger side of it? And secondly, what is your advice to them apart from the medicinal part of your conversation with them?
So I would add another perspectives from my. I also try to understand psychology.
Very, very crucial part of being a doctor, I would say.
What I would say, people like us, not just Indians, it's across the globe. We consider health as our birthright.
Absolutely.
We are not meant to get sick.
That way, yes.
That we are not meant to get sick. Once we get sick, then to get treated is our right, and we should not be paying for that. People are ready to pay for expensive cars, expensive gifts.
Yes.
But to get health insurance comes very far into their minds.
Down the list of our priorities.
Yes.
Yes.
So I think that psychology of seeking healthcare when they're actually sick needs to be changed. Seeking healthcare and health advice when they're not sick should be prioritized.
Absolutely, absolutely. I get your point, definitely. And for that, awareness is something which, how do you see that? The urban audience, the urban diaspora people are more aware, or the rural people, they think ki, हाँ भाई ये ठीक हो जाएगा?
No, it's not urban or rural.
It's common.
It's common. The urban population is more worried because there are economic impact on that.
Okay.
In rural population, they are less worried about it. There's self-sufficient economy, and they're more worried about losing the money if they go to the hospital. in urban population is more prevalent because they lose not just the money when they go to the hospital, they also lose on their economic aspect when they are out of their jobs for maybe a month or so.
Right.
So that is the reason that people choose to get insured, that they don't want to pay that extra burden when time comes.
Right.
But still the penetration of insurance in India is very, very poor, I would say. Even though government is helping big time by coming up with like populist schemes like Ayushman, and every state also has one of the other schemes which is helping patients to seek treatments and get treated in best of healthcare facilities across the country. But still, people do need to understand that it is not self-sufficient.
Right.
Government can only help when people take initiatives.
Absolutely. See,
so they have to get listed for these policies. They have to get their papers in place. For insurance companies, they have to for insurance they have to pay premiums on time, and they have to understand the policies well so that they can get treatment effortlessly when they actually need it.
Yeah. Very, very critical aspect, Dr. Bansal, and yes, for our viewers, once again, I keep referring to them because it's for their benefit. What Dr. Bansal mentions is very critical here, that we often say कि विदेशों में ऐसा होता है, विदेशों में वैसा होता है, but एक चीज आप और भी ध्यान रखें, विदेशों में health insurance भी बहुत महंगा होता है. India में comparatively it is cheaper, yet the penetration, as you say, is not that good. Dr. Kaul, talking about the monetary part of taking care of the heart, हमारे पास technology है, we have advanced technology, we are going even further. When it comes to the government efforts, what is being done, and what do you also tell your patients who are not so economically capable to go for high-end treatment? What best avenues do you suggest them?
See, first of all, let me put it this way. Cost of getting heart surgery or heart treatment in India, in my opinion, is lowest in the world.
Okay.
Now, I have a patient whom I operated just 10 days back. This patient has come from Dubai. He's a Filipino.
Okay.
So I told him, why are you coming to India? Philippines, Manila, I know Manila Heart Center is a very advanced center.
Okay.
Or why don't you go to Iran or Turkey or somewhere? Why do you come to this place? He said, sir, I went across. In Dubai it was very expensive, so I thought, let me go to Philippines. It's 3 times the price in India. He had done a thorough research and found that in India a bypass surgery or a stenting is lowest in the world. So even in Africa, I operate in UAE, I operate in Tanzania, Kenya, all other places. Heart surgery is very expensive. It is at least 4 to 5 times more expensive than in India. It's the cheapest in the world. Now,
this is huge.
We have population of a problem of poverty, so there are many people who won't be able to afford this. But let me tell you one thing: this Modi ji's initiative of this Ayushman Bharat.
Absolutely.
I think it's a game changer.
Wow.
You have, and not only that, I went to operate in one of the hospitals in Lucknow, and I was amazed that how government is supporting even in private hospitals.
Okay. Okay.
So now, I mean, for the last, I think 5-6 years, there are many states like Telangana, Andhra Pradesh, West Bengal, where government is giving subsidy and giving some money to these patients to get operated in private hospitals. Wow. Unfortunately, I think in Delhi this is not very popular, but in rest of the country there are many states which are doing this. So this is, but on the other side we have very good government hospitals. See, I'll tell you one thing: GB Pant, Maulana Azad, Ram Manohar Lohia, All India Institute of Medical Science, of course, is a different class apart.
Yes.
But even these hospitals have very good facilities. The problem is, in my opinion, the only problem in our country is overpopulation.
The number of patients
that
you
even in these hospitals, you don't get. The problem is appointment for surgery. That is the only thing. That is, so if you ask me about this World Heart Day, just think of one thing: control population.
Well, it is interconnected. You are right. It is interconnected.
I mean, our resources go waste because I mean we can't manage. I think we have to understand one thing: you can't provide help for such a, I mean, how can you, there are at least 200 patients in cardiology OPD every day. How can you see these patients? So overpopulation is the biggest problem.
Indeed, and that one aspect, is proving to be a deterrent also when it comes to timely testing. We saw, remember, there was a time when the labs during COVID-19 testing also could not take that load.
Absolutely.
The reports started taking time. And by that time, the person who unfortunately was positive had already made 3 more or 4 people positive again because coming in contact. So that load, Dr. Kaul, I must say that is something which is not directly visible, but yes, is putting strain on the system. Dr. Nag, obviously, when it comes to these testing results, and very crucial part, because these are the initial signs that you read. As far as the blood, the pathology is concerned, the several tests are concerned. In your opinion, what is it that is, as of now, the need of the hour, could be done better or should be done better in order to cater to more and more people?
So what is most important is that we should think more about screening. See, as Dr. Kaul also said, that we don't know that disease is silent, it is running inside, and there are so genetic factors which are running. You cannot change your parents, as said. So you are born with that. So timely screening is most important. So like dyslipidemia is totally silent. Recommendation says that you should test at least once for lipid profile before the age of 20. Post age of 20, you should check at least once, and in adult it should be practically an yearly checkup. So those things are missing, because that is the time you can nip at the right time. You can go to a doctor. It might require some clinical interventions or medical interventions in terms of drugs and all. But if they are taken timely, you can prevent that cardiac event. So what is most important is screening. The good part is, see, previously we had fewer tests. There was no home collection facilities, lesser of collection centers. Now penetration with technology, home collections, these things are really easy. It's just the intent which is required at least. And there are recent guidelines. Previously lipid profile was to be done only in fasting state. So that also adds to a difficulty that you have to get it done first thing in the morning, etc. Now for screening, a non-fasting lipid profile is equally good. So, and if it is high by a particular level, then it has to be repeated in a fasting level. So those are the things which need to get implemented and go deep in the population. So that at population level we start screening and take the things forward.
One also crucial aspect that I would like to ask Dr. Nag before we move on to Dr. Bansal. You know, many a times, and I hope that you might have also received such phone calls coming from different lab testing centers saying कि एक आप फैमिली हेल्थ चेकअप करा लीजिए या हमारे पास इस तरह का पैकेज है. How important as of now it is to actually heed to them, or is it only the doctor's prescription that we should go for these vitals checkups like cholesterol, lipid, LFT and all?
So see, we have to understand, report is something which is telling you about your body. It is not treating. So doctor, so getting it checked by doctor is very, very important. But yes, you can plan your own preventive testing. See, I have seen a trend, being a doctor in family, etc. There are many people who will keep on testing, but they don't action on it. So action is required on the reports. But yes, timely testing by a good lab where you can rely on the reports is very important. And at times there are routine checkups of preventive does not require a prescription as such, but acting on that report by a clinician is something very important and should be stick to. You should go with your reports to your clinician to understand what is actionable, what to be done, rather than just googling out and doing some interventions on your own.
Self-medication also included. Dr. Bansal, you know, once again we come to a situation where going to a doctor at times we are generally afraid of it and we procrastinate over it. कि तभी जाएंगे जब कुछ होगा अच्छा भी देख लेते हैं. Again, the sum up of this whole conversation, I think, is about timing, the timely intervention, the timely tests. In your opinion, what is it that we should be very carefully watching? You know, our wearable might tell us our heart rate is off or not, but other than that, what is the general perception or general things that we need to be careful about?
So I'll take your role. I'll ask you a question now.
Uh-huh.
So what should we be afraid of, whether it's the treatment or the disease?
I think we are more afraid of the consequences that what will happen to.
So what generally happens is patients do not go to the hospital or to the doctors because of the fear of the diagnosis that might come out.
Yes.
They think that if we go to a doctor and if we get tested, there might be something within us which might come into picture, and we might have to go for the treatment. So the people are not afraid of the disease. They are more afraid of the treatment.
Treatment, yes, the second part of
yes.
it. Yes.
But should be the other way around.
Absolutely. The disease is risky.
Disease is risky.
Yes.
Treatment part, there's somebody to help. There's whole world to help.
Yes.
So early identification, like answering your question now, early identification and keeping a track of your own activity and health parameters is extremely important. Like checking your wearable when it says the heart rate is going up. We can pick up a phone call and call your doctor.
Absolutely, fix an appointment.
How difficult is it? If we are seeing that our blood pressure is going high, rather than just cutting down salt in our diet and keep watching the wearable every 3 or 4 times a day about checking blood pressure, versus going to a doctor consulting that this was my wearable which was showing my high blood pressure for last 1 week, and I've already cut down my salt intake. This is the best what I could do. Please tell me what else can be done.
Right, absolutely.
So that consultation part is extremely important. Definitely, identifying comes before consultation, and for that identification comes like the symptoms, what a person can feel. He can feel when we are talking about heart, he can have chest discomfort, maybe early fatigability. If somebody was walking 3 kilometers without a problem, and now he's just able to walk maybe 1.5 to 2 kilometers, that is early sign.
Absolutely.
That he can still walk for a kilometer or more, but not as much as he could do a month back. So that is early sign, that easy fatigability. When he is feeling lethargic, there's chest discomfort which is not related to food every now and then. Breathing difficulty.
Yes.
Body weight gain or body weight loss without any reason.
Is also
it could be gain or loss, anything, but it has to be collaborative with the reason, whether we are eating more in festive times or we are exercising more and we are losing weight. Either of them could be harmful.
Has to be a reason.
There has to be a reason to everything. Nature does not cause anything on its own.
True.
The same with our body. There's a circadian rhythm, and we have our daily routines.
Yes,
we would not get tired one day and but till now we were all okay, and today evening I start to have chest pain, I keep sweating, but I think it's too hot outside. When
could be something else.
Could be something else. So that identification is important, and so is early consulting.
Right.
I don't think these are the times when, at least in urban population or maybe semi-urban, when any of the doctors is not accessible. We have doctors everywhere now.
Yes.
Like even close to our house, maybe 5 minutes drive or a 5 minutes walk. We have a general physician who we can ask. Maybe somebody in the family who we can consult.
Right.
We can do online consultations. So early identification of the symptoms and early detection, that is early consultation and detection, are the key.
Definitely. I mean, yes, prevention is better than cure.
That is the message that I will take for myself. And finally, I mean, we have arrived at that part of the show when the floor is yours, doctors. On the World Heart Day, your message, Dr. Kaul, to our viewers, succinct yet, I'm sure, poignant.
See, my message would be use of wearables, very good, but the moment you find something is going wrong, do consult a doctor, because I strongly believe that if you want to bring down, you don't want to face any crisis, emergency or sudden heart attack, it's very good if you consult a doctor in time. Early detection is very, very crucial. And last thing would be that cardiovascular diseases fortunately are preventable. You can prevent at least 50% of these diseases. You don't need to undergo bypass surgery or stenting if you take timely action.
Absolutely. Dr. Nag.
So I'll just sum up. Thinking about health is good, acting on health is most important. So we need to act on
We should be very clear on what is required by our body, should go for a timely consult and act as per medical advice for that.
And finally, Dr. Bansal.
So I would not repeat what Kaul sir has already said. So I would add on to that patients, or even not the person who is not even a patient yet, should be aware. Should be aware of the diseases which could be breeding inside. Should be aware of the diagnostic modalities which are available. Should be aware of the treatment options which he has. It could be just periodic monitoring.
Absolutely.
The patient would not need any kind of intervention. It could be just periodic monitoring. That also is one of the available treatments that we have to just watch.
Right.
It could be advancement in technologies guiding towards early diagnostics. If somebody is aware, then only he can go for it. Eyes only see what brain knows.
Right.
So also for the treatment, if somebody has to get treatments for heart disease, it could be electrophysiology, it could be therapeutic stenting, it could be bypass surgery, it could be valve surgery, it could be robotic surgery. Anything can only be sought after when somebody knows.
When you know about it. Obviously,
so awareness
knowledge.
is the key, whether
Awareness.
it's prevention, diagnostic or treatment. Everybody has to be aware.
Absolutely. Thank you so much, gentlemen, for taking time out, for speaking to us, and also leaving us all very much informed, very much in control of things. And as the panel here suggests that yes, technology is something that is keeping us ticking, but with that, we also need to watch ourselves. And please, please, please don't be shy to pick up your phone and consult your cardiac doctor to get an update on the signs that you see as well as the health of your heart is concerned. Thank you so much for watching this place. Thank you. Have a good day.
Thank you.